Welcome to the History of Retina's Leaders and Legends series. The purpose of these interviews is to capture first-hand stories from individuals with unique retinal insights of historical significance. Through these discussions, we hope to provide a fuller understanding of the evolution of both the science and practice of retina through the lens of those individuals who have actually lived it. For more than 5 decades, Evangelos Gragoudas has been innovating, inspiring, and educating in our field of retina and ocular oncology. From his humble childhood on a small island in Greece, Evan has established himself as a true giant in ophthalmology. Early in his career, Dr. Gragoudas trained under the father of modern retinal surgery, the illustrious Charles Schepens. That transformative fellowship and his training at the Mass Eye and Ear Infirmary turned into a career-long commitment to the institution and set the stage for the groundbreaking advances he would go on to achieve. Dr. Gragoudas' numerous accomplishments include pioneering proton beam irradiation for uveal melanoma and contributing to the development of photodynamic therapy for macular degeneration. He is a pivotal member of the team that uncovered the role of VEGF in age-related macular degeneration, dramatically shifting the treatment paradigm and paving the way for sight-saving therapies. His research has not only saved vision, but has literally saved lives, giving hope to millions of our patients worldwide. An impassioned educator and mentor, Dr. Gragoudas has trained generations of fellows and residents, instilling in them the same spirit of innovation and discovery he learned from Dr. Schepens. It's no surprise that Dr. Gragoudas' professional accolades are extensive, including receiving the Jules Gonan Lectureship of the Retina Research Foundation, the J. Donald M. Gass Medal, the Arnold Patz Medal of the Macular Society, and the Mildred Wiesenfeld Award for Excellence in Ophthalmology from the Association of Research in Vision and Ophthalmology. Welcome, Dr. Gragoudas. It's a pleasure to have you join us. You come from a very small Greek island. Can you tell me how you get from that Greek island into medical school? Because that in itself is a story.
One guy from my village was a taxi driver in Athens. And he was a customer, he had a customer, and he was talking to him and he said, I have this, young kid that, is first in the class and so forth and so on. He wants to come the last year in Athens to get prepared for the medical school, because for medical school we have entry exams. He said, okay, if he's good, I'm going to take him into Varvakion. Varvakion High School was the best high school in Greece. So I ended up, last year of, high school in Varvakion. And I prepared for the entry examinations, out of whatever, 1,000 people, only 200 were admitted. So I went through the examination. All of these were written, no oral examination. And I went back to my village. And the funny thing is that the results they don't send to you. They publish it in the newspaper. So one day, somebody, early in the morning started knocking on my door at home. And my father opened and says, it's Vangelis, my name. Awake. I said, what? All the newspaper published, the people that were, entering medical school. And he's third Oh, celebration of the whole
For the whole
of the
island,
whole
probably.
village, of the whole village
Correct.
of 2,000 people. Okay. So here I am, and I got into medical school there.
So that gets you to medical school, but there weren't even textbooks available to you at the
That's
time.
true, yeah.
That's how you start writing your own book?
Yeah. We had, with another friend of mine in ophthalmology in the fourth year medical school, we had a professor that didn't have a textbook. So we said, well, we kept notes from his
lectures,
teaching,
classes.
lectures, things of that sort. And then we said, well, why don't we publish that and make some money?
Of course you did.
So the first, ophthalmology, quote-unquote, textbook was Gragoudas Galinos, and we published, and it was very successful in the SUSE. Everybody had to buy that. So that's how I got into ophthalmology. After, we just kind of made all this effort, and, I said, oh my God, we learned so much, And it was a nice specialty that we liked very much because it had both. It had both, examination and diagnosis, and also surgery.
You're still in Greece. So how do
Still
you
in
get
Greece.
from Greece to the U.S.? That's a big leap.
Yeah, it was. That's true. What happened was we got a dictatorship in Greece. And after that, I said, I'm out of here. I cannot tolerate this kind of, environment. So in order to come to the United States, you have to pass exams. One exam is medical, and the other is language. And the language was in the American Embassy. So I said, okay, the exams were written. I don't have any problem with the medical exams, I just kind of pass those. And the language, my English were very poor, to say the least. So I go there, they asked me some questions, I gave some answers, and so forth and so on. Anyway, to make it short, the results came back and he said, you passed. I said, my God, that's unbelievable. I knew English and I didn't know that. So here I come to the United States because another guy, Greek guy, was intern in Waltham Hospital in Massachusetts, Waltham. So he said, well, this is a small hospital, but basically, there are enough good doctors here,
So how do you get from your internship,
Yeah,
first experience in the United States, and now you're going to get into an ophthalmology program?
As you know, ophthalmology was, extremely difficult to find residents. So I applied for, 50, 60, and I didn't get even an interview. So what should I do? And there was a Greek guy who was working in Jocelyn Clinic. And he said, I have, Lloyd Aiello is an ophthalmologist here. Why don't you come to spend some time with him here, so you can have a chance, to kind of get into the field. So I went in Jocelyn, and I met Lloyd, and actually, even his father, Bithan, and I learned to use the ophthalmoscope and so forth and so on. And then Dr. Ephraim Friedman, the chair of Boston University, came in, had some ideas about, diabetic retinopathy, the causes of that, etc. And then Lloyd said, I have this, young guy here, very nice guy, whatever, he wants, began to do ophthalmology, but, he cannot get even an interview. I said, okay, why don't you come to BU to do some kind of research with me? So I went to BU, started working with Dr. Friedman, and he was obsessed with macular degeneration at that time. And he had all these ideas about, scleral rigidity, that basically, sclera get rigid and you have exudation, etc., etc. So I went with F, work, and I was asking him, to write letters for me, recommendation, all around the United States to make sure that I get an interview. So, I can. Anyway, after, he's written I don't know how many letters, I go one day and said, F, sorry to bother you again, but I want another letter, for this ophthalmology department. And he said, go home, there is a letter for you. I said, you missed my point. I want to send the letter in order to get an interview.
I think he's thinking you missed the point.
And definitely he was right. So I go home. There was a letter from him. I open it and he said, the letter, you are first year resident now at Boston University, and you have to do X number of cataract cases before the year is over. That was around, March, April.
Right.
So this gentleman, this guy, this professor, it was my savior, you won't believe it. He basically, saved about 3 years at least until you get, this and that. And he was, my mentor. We started doing research. I published my first papers with F about macular degeneration, the natural history of this, and the rest is history, as they say.
Dr. Friedman was kind of unique. People thought he was a little tough. What did you think?
I think he was a brilliant guy, to begin with. I think that he had, continuous ideas. He loved research. He was a very good surgeon. I did quite a lot of retinal detachment operations with F. And we became, very, very close friends.
Yeah, I love that. But now, when does your all of what you're doing seems to focus on retina. Tell me how fellowship programs work then, and tell me how that happened for you.
My interest in retina, obviously, started very early, by being in Joslin and, looking at diabetic retinopathy patients. F, told me to go to retina, but he didn't have to tell me that. A decision was made. And I said, I have to do a fellowship. And he said, well, one of the best fellowships here in Boston with Dr. Schepens.
Now, let's be clear, not the best fellowship in Boston, one of the best fellowships in the world.
Yes, it was at that time, there was a number one and number two, but certainly, the two most competitive one was, Boston and Bascom Palmer.
Seems like it's always that way.
So I talked to F. I sent for this. He says, there's no question about it, either here or there. And he wrote a letter for recommendation for me. And Charles Schepens said, we don't have enough spot, for this year. He can come and spend, do some research before. And then, he continued to be, as a fellow.
But that was kind of the thing back then too, wasn't it? You came
yes.
and did research before you were a resident. Then you were a resident. You came and did research before you were a fellow, and then you became the fellow. So many of us think of you because of your melanoma work, but you were quite the surgeon. You were an eclectic retina specialist. You trained with Dr. Schepens. How do we get you to your next position?
Yeah, that was kind of a very interesting situation, I was planning, after they finished my fellowship, to go back to Greece. So there was a neurosurgeon at the Mass General Hospital that was using proton beam irradiation to treat, brain tumors. And somehow he knew the director of the retina service, Charlie Regan. And he said, Charlie was treating retinoblastomas with X-rays. And he said, Charlie, why don't you, use proton beam irradiation for, retinoblastoma. And at that time, in Constable, fellow from Australia was there, and Charlie talked to him, and he started doing some experiments with monkeys to see how he can align the beam with the back of the eye and so forth and so on. So then he got a call from Australia to become chairman in Perth, Western Australia. So he comes to me, he says, Evan, listen, this is an interesting project. I don't have time, I'm going back to Australia. You want to continue that?
What a pivotal moment, right?
Oh, yeah, that was it. That was a pivotal moment. After we finished the monkey experiments, etc., so that said, well, forget about retinoblastomas. This is very difficult. We need this and that. I will move to melanomas. And then the question is, how to get the first patient. So one day, my secretary calls and says, there's a patient here with a melanoma. You want to see him? Says, sure, let's see him. So I saw him, and he said, I heard that, you're working on a project to treat, these tumors with proton beam irradiation. I said, Mr. McKelvey, we're not ready now. We have, quite a lot. We have, work with bite blocks, head, all the head equipment and so forth and so on. It will take time, He said, Dr. G, I will be in the hotel. And when you are ready, give me a call.
Wow.
It was, fascinating. Sometimes, you need some luck in life. No question. To convince a patient with a melanoma, to be the first on a kind of complicated arrangement, it was a nightmare, by thinking about it. And here is a guy that says, I'm going to stay here until you treated me.
I love, the trust that your patients have, that our patients have in us to help them. But you have some unique skill because you presented an option to a patient that no one else had ever experienced. And for those of us that have been able to do that, that does require a special patient and a special relationship, and you're kind of linked forever. So amazing.
Well, it's, this is a question that applies, for anything in medicine. I think that, as far as I'm concerned at least, the first thing that is to establish, some relationship with the patient. He's not somebody that comes and goes, it's somebody that, kind of hopes that you are going, to help him, and especially, for a complicated diagnosis like this. To have a malignant tumor in the eye that, you can die from metastasis, etc., so.
And, I think one of the things that I've always loved with you is that you are very scientifically focused, but you're very down to earth when you talk to people, and you love to teach.
True. I think that starts with, as I mentioned before, F. Friedman at BU, that basically he was a retina specialist, and, he was one of the brightest people, I would say, that, during my career. Somehow, we connected, very early on. I was, first year resident, he was, full professor there, and, became dean of medical school. But he kind of, inspired me how to talk to young people early on in their careers that they have all these, problems here and there that basically became, kind of quote unquote equal, talk to me, And the fascinating thing that I loved about him is basically, he had a big office in the time. We can sit down there and kind of, look at the paper and so forth. Let's go out, sitting on the stairs, where the medical students walking up and down, just to go there, down to my level.
Well, we talk about mentorship a lot,
Yes.
right?
Yes.
And it seems like you had people touch your life and your career in remarkable ways, and then you give back.
I loved it. I loved it, and I said, well, how many people, went through the pioneer, they became, famous, we can have names like, Don D'Amico and, Karen Pugliafito, he was working, on OCT, when I was there, and I certainly, encouraged him quite a lot, and he did quite a lot of work. And again, it's kind of interesting that I used to this phrase quite often, which is true, that you cannot grow flowers in a desert. And that's, really, kind of, everybody throws it left and right. But if you think about it, I wouldn't have done anything if I was not at the Pioneer Infirmary.
When you're there in Boston with this all happening around you, what are some of the moments there that really sort of struck you as exciting moments in the history of Retina?
Well, basically, the two areas that, I kind of worked all my life is the macular degeneration issue and the ocular melanoma issue. And this is kind of combination of factors. As I mentioned to you, macular degeneration is because of F. Friedman. That basically he was obsessed. I can use that word, suppose that that basically we have to find some kind of treatment for macular degeneration. And the other is the proton beam irradiation issue that I was lucky to be at the place at the time. Basically, the neurosurgeon recommended that to Charlie. Charlie recommended to Inconstab. Inconstab got a job. And then I kind of got, quote unquote, stuck. And the reason that I got into the field is because, I would kind of do some research, write some papers to go back, to Athens. And after I got into it, it was so exciting, really, just kind of got into it big way, reading about melanomas, doing this, doing that, just kind of. And it was fascinating because we had, kind of a unique opportunity at that time, That's the only facility that you can do this kind of things. And, after the results came back and were so spectacular and so forth, so that's kind of changed our history.
Tell me a little bit about the conference structure and what you did and how you shared that with the younger doctors.
Well, certainly, when I became full-time staff at the INA Infirmary, I was not busy. At that time, it was the beginning of fluorescent angiography, and F. Friedman got into it big way. He loved circulation. He published all these papers on circulation. So when fluorescent angiography came, so I had the opportunity to work with him on fluorescent angiography. So when I went to the INA, really, there was nobody, to kind of know as much as I did.
Right.
Despite the fact that I was very young. So I started doing, the so-called fluorescent conference. Once a week I had, the junior resident to present cases, and I had, the senior resident and fellows, clinical fellows, to discuss them.
Well, I think that you started introducing a different method of education. To me, a lot of the experience was almost apprenticeship. Was this one-on-one and you just watched the doctor or assisted the doctor, but there wasn't really a lot of teaching. Is that correct?
Yes, I think that basically there are different ways of education, and the giving a lecture, no doubt it's good, but it's completely different than having, 2-3 people that basically they're, young and inexperienced and, know very little, and how to interact with these people and, just kind of prove to them that they don't know so much as they think. It's a kind of a talent because some people don't like it, some people love it. At the end of the day, I think that after all this experience is over, everybody appreciates the fact that you push them to think.
I think that everybody understands your role in melanoma and proton beam therapy, but I don't think people always appreciate how extensive your role was in macular degeneration. And you've told us where it started, but take me through that story at Mass Eye and Ear, because Mass Eye and Ear was also a center that evolved care for macular degeneration, and it happened with you.
Lucy Young, she was, my associate, etc., etc. And we were working on an experimental melanoma on the rabbit. So one day she came to me and said, well, we can do this, treatment with photodynamic therapy. There are some people that treat this at the Mass General Hospital. Coming back to the, you cannot grow flowers in a desert.
Exactly.
So she came, we tried that, photodynamic therapy on, experimental melanoma in the rabbit. Didn't work out well. But, I've seen that some of the vessels, were closed. So we moved on, to treat macular degeneration. And the rest is history, as they say.
Well, in some ways, it was too good, because here you have photodynamic therapy, but right at the same time, overlapping photodynamic therapy is the anti-VEGF VEGF story, which really plays out in Boston. So can you talk about that a little?
It's a unique story. I love to say that. One day I was sitting in my office, and a guy calls, says, my secretary comes in and says, I have this young guy, Tony Adamis, and he wants to talk to you, about something. I said, okay, fine. So Tony comes to me. Tony was a cornea fellow, and he wanted to do some, research, and they sent him to work with Judah Folkman. And he worked with Judah Folkman on the VEGF, agents and this and that, and the importance of VEGF. So I said, okay, Tony Adamis, that sounds to me like a Greek name.
Exactly.
I cannot refuse.
Even though he's a cornea fellow.
He's a cornea fellow. So here, I still remember laughing with Tony, many times. We were together in a meeting. Anyway, she is sitting just across me, like you do now. And we said, Evan, something, I think that, this anti-VEGF treatments for cornea, it's not a big issue. I think we should use it for macular degeneration. And I remember what I said. I said, Tony, if you were not Greek, I would have thrown you out of the office. You're a cornea guy, and you are going to come to me to tell me how to treat macular degeneration. Is that?
That reminds me a little of you, actually. So there's a little chutzpah there.
Yeah. Anyway, the rest is history, as I said. Tony started, 2-3 companies with my fellow, and they did very, very well, both, First of all, producing products, and second, becoming multimillionaires.
Right. So I'm always interested in what you have to say. What keeps driving you?
Medicine is not an occupation. Okay, it's a profession. I think that's a big difference, It's an experience and, quite a lot of gratifications, to see, progress in the field, and for some people, like me, and I go back, 50 years and see, what we were doing than what we're doing now. I mean, it's, it's kind of fascinating. Fascinating, really, to see the progress in the field. And I always, kind of get a pleasure of, seeing, young people, coming with a new idea, presenting some, data and so forth. So it's kind of, satisfaction, in spite of the fact that, I didn't, kind of work with this, young person, and, I had nothing to do with him, but the fact that, he had, this kind of idea, or, this kind of experiments that he did, and,
Exactly. Well, Dr. Gragoudas, I just want to thank you for spending time with us and talking to us. You have a fascinating story, and you touched on so many things that are pivotal to our field and the people in our field. So thank you very much, Evan.
Thank you very much.